So far, regarding gut microbiota management in the setting of allogeneic stem cell transplantation, this is mainly investigational because we have no drugs approved to improve, to restore, to preserve gut microbiome after allogeneic stem cell transplantations. So we have two fields now that we are going to investigate. This is the treatment of acute graft-versus-host disease with some very promising results that I'm going to discuss later on in the interview. On the other topic, we can develop. This is the preventive strategies. There is some preliminary report that have been published maybe by the US that show that this is feasible to perform some fecal microbiota transplant after allogeneic stem cell transplantation to restore the gut microbiota diversity, but it just shows the feasibility, and so far we don't have any data that show if this is effective to prevent or to reduce the risk of acute graft-versus-host disease or other complication after allogeneic stem cell transplantation. So we really wait for such study into the next years, the coming years, to know if this is feasible and if it will improve our patients' outcomes.